Dr. Brian Rajca, a gastroenterologist on the medical staff of Lee Memorial Health System, sees hundreds of patients suffering from heartburn and acid reflux.
Only 10 to 15% of people who have chronic heartburn symptoms actually get Barrett's esophagus. And once you get diagnosed with Barrett's esophagus, your risk for getting esophageal cancer goes up.
He says Barrett's esophagus forms as the body's way of coping with acid exposure.
But the problem being is that as the body copes to create these different cells, they're growing in a place they should not normally grow, and that's what allows them to continue to progress into esophageal cancer.
Another problem, patients don't have symptoms. He says men and those who are obese are at a higher risk for developing Barrett's esophagus. He suggests patients get screened if they're over the age of 50 and have new onset heartburn or have had acid reflux for the last 10 years. The screening takes about 10 minutes. Patients undergo anesthesia while experts use a scope to look at the inside of the esophagus and stomach.
And we can get biopsies if we see any abnormal changes in the tissue to confirm if Barrett's esophagus is present.
If Barrett's esophagus is found, the treatment will focus on medication and lifestyle changes to reduce acid exposure to the esophagus.
So not eating for several hours before you go to bed, not eating large meals or fatty meals, minimizing alcohol, because that will promote reflux. Also being on the acid medications.
The patient will be monitored by their health expert every 3 to 5 years. For Lee Memorial Health System, I'm Lindsay Fry.